It is very important to remember that anytime a patient has been scanned for 3D volume, or 2D for that matter, the entire area that's imaged needs to be viewed and evaluated. If perhaps you see something you're not familiar with while going through a volume, or perhaps even a panoramic image, then you would want to refer to a specialist, such as an oral and maxillofacial radiologist, or perhaps if a biopsy was necessary, to an oral and maxillofacial surgeon. In order to fully evaluate the patient's volume, the NPR view must be used. And again, it's not just a legal requirement, but is an ethical requirement that any part of the patient's anatomy that's been imaged be reviewed. In this case, you're responsible for going through the anatomy and recognizing any differences from normal. If you see something that's abnormal, you needn't write a report or do a differential diagnosis, but merely refer the patient's images, either those obtained in Reporter or the entire volume, to an oral and maxillofacial radiologist for a review. You would begin by the axial or coronal view, starting at the bottom or top, and this again is where it helps to have the 3D view, and proceed upward, looking at cortical contours, looking at differences in symmetry. In the axial and coronal view, you have a right and left side. And you can observe differences in the right and left side as you move up or back and forth through the anatomy. And again, we're following the progress of this orange outline image layer to know where we are in the patient's anatomy. In this case, some people prefer to use the surface mode, which looks more like a familiar skull, or you can go back to the volumetric mode. Proceeding up, and I'm looking at the integrity of the bone, looking at the sinus cavity for perhaps sinus disease, the temporomandibular joints, the airway space, any sort of abnormal calcifications that might appear in the soft tissues. Here we see the sphenoid sinus, the ethmoid air cells. Once I'm at the top, I then proceed downward again. In other words, I'm viewing the anatomy axially and coronally twice. If I see something, such as this gray area, I double click and I see what it looks like in all three dimensions: axial, coronal, and oblique. In this case, we see it's a polyp in the sinus cavity. If I want to report on that, all I need to do is go to Findings and create a report. So I will mark that area and come back later and make a report. Moving back through the patient's anatomy, I generally like to double click in the midline so I have the sagittal view in view. And now I continue moving downward in the axial view. Again, going through the same anatomy, looking very carefully for changes in contour, cortical bone thickness, trabecular pattern, abnormal calcifications both within the bone and outside of the bone. Now I'm back to the starting point. In a similar fashion, I'll start the coronal view from the patient's anterior aspect and then move backwards. And you can see how I'm moving backwards by following this orange outline image plane. And again, I'm going through the sinuses, zygomatic bone, the maxilla, the dentition, evaluating for apical radiolucencies, unusual calcifications. Any sort of asymmetry should be evaluated, and evaluated in all three dimensions, such as the case with the nasal polyp or the sinus polyp. Now I'm back into the cervical vertebra, which, by the way, is an excellent landmark for determining if patient motion exists. We also note that the soft palate is blocking off the airway. In this case, that may be an indicator that the patient could have sleep apnea, but that would only be determined by a sleep medicine study. At any rate, it's good to mention things like this to the patient or to the referring clinician. So now we continue to proceed forward, again evaluating the temporomandibular joint, the airway spaces, both within the bone and in soft tissues. Nasal cavity, here we see another sinus thickening. I will double click, and I see it's just thickened mucosa in the sinus, which is no cause for concern. But I have evaluated this asymmetrical finding in all three dimensions, which is the proper way to view these. Again, I'll return back to the midline and continue moving forward until once again I've gone through the coronal anatomy twice. If I see something, again, unusual, I will then refer to the sagittal anatomy. Since the sagittal anatomy does not have symmetry, a right and a left side, then I don't go through that unless I see something unusual. So that is a proper way to go through the volume of a patient, which should be done for each patient. With training, it would take about 5 to 8 minutes for each patient. But be sure to go up and down, back and forth in the axial and coronal views in order to thoroughly evaluate for any abnormalities. And again, if there are any questions, refer the patient scan or several pages of reporter to an oral and maxillofacial radiologist, or if in your opinion a biopsy is warranted, to an oral and maxillofacial surgeon.